Hi, my name is Jane Bertrand. I'm chair of the Department of Global Health Systems and Development. This department scans a wide range of areas, from improving electronic medical records here in New Orleans, to strategies for saving women's lives in childbirth in Latin America, to establishing surveillance systems for the malaria epidemic in sub-Saharan Africa and evaluating programs to try to reduce malaria. So our faculty have a very wide range of interests, and I think this helps potential students because they're almost sure to find some faculty member that shares some of their own interests. Here at Tulane, I teach two classes. The first is on monitoring of program interventions in global health. This is an introductory course that a large number of our students do take because it's a requirement for two of our concentrations. The second is a more specialized course. It is on the systems used to deliver family planning in the international context. For students that like a small seminar environment, that's perhaps a good course. In terms of my own research, I'm currently involved in projects both in sub-Saharan Africa and in Latin America. With funding from the Bill and Melinda Gates Foundation, we're currently working to advance family planning in the Democratic Republic of the Congo, Burkina Faso, and Mali. A second project, which is perhaps one of the first of its kind, is the systematic monitoring of voluntary medical male circumcision in 4 countries of Eastern and Southern Africa, which is one of the newest strategies being used by the international community for HIV prevention. In Latin America, Tulane has recently completed one study in Guatemala City on HIV risk among drug users in that location. Our second project involves a 50-year retrospective analysis of one of the most successful interventions in global health, family planning. In this analysis, we'll be looking at the factors that have determined that success, with hope of finding lessons applicable to other parts of the world. I could not have done these projects without the help of both master's and doctoral level students who have been very much involved in these different phases of their development. If a student were to ask me why go into public health, my answer would be it gives the opportunity to work in one of the most important, intriguing, and challenging areas one can imagine. The colleagues that work in this area are among the most dedicated I've encountered in my life, and the organizations have a real sense of mission. Whether it's here in New Orleans trying to work with disadvantaged populations, addressing some of the very challenging problems of sub-Saharan Africa, Asia, Latin America, emerging countries around the world, at the end of the day, when you ask yourself, is the work I'm doing making a difference? It's easy to say yes.